Good afternoon. Welcome to our third quarter TAC Health Huddle. We're here today to talk to you about something that we kind of hear a lot about, something that we see a lot in the claims, trying to figure out kind of what we're doing. So today we're going to be talking about where to go for care. And so before we get started, before we kind of get into our spiel, I'm going to introduce everyone up here. We have Jonathan Cauliflower Colander for those who are not Ernesto. We have Kathy Hitman Davenport. We have Clarissa, the Silent Assassin Messenger. We have Ern the Fern Martinez. And we have Orlando, apparently Disney Espinoza. Yes. So we're going to come and talk to you guys about this. We are going to have a fun, interactive quiz at the end. So it is going to be through Kahoot. So we are pulling up some... we're going to pull up the Kahoot right now so that you guys can look at it. You'll be able to have the to log on and get started on it right now. So that way, whenever we do get to it at the end, you're already kind of ready to go for it. So if we can, let's put that Kahoot on the screen and get signed up. When you get signed up, let's do put your name and then put your county or group name also, so we know who's there. There may or may not be a prize for the winner. And I say may not because Ernesto might be delivering it, and he's not known for delivering things very well.
May not get there.
So hopefully he'll remember this time. But it'll be fun. It'll be a fun, interesting, kind of wrap up to this. But then there also is a chat box on the WebEx. So if you have any questions as we're going through this, feel free to type that into the chat box, and we'll try to get to those questions at the end. And we'll give you just a second longer to get logged into that Kahoot, make sure that you guys are up and running, and then we'll get back to our featured presentation. All right. Okay, so talking about where to go for care. So the big thing here is, on these quarterly webinars, what we try to do is we try to bring you guys topics that are relevant, not just to the coordinators, but also to your employees. Try to figure out what things can we bring that we hear about, that we're seeing in the claims, that we can really help you guys with. And one of the big things that we see is, maybe people are going to the place that's not appropriate for what they're looking for. So one of the big things that we're going to be talking about today is we're going to talk about the different options of care. We're going to learn to navigate through the jungle of the different options that you have. We're going to talk a little bit about freestanding ERs, kind of how we can tell the differences with those, why it's important. Big thing for me is saving money. I don't know about you guys, but I don't have a ton of money that I want to spend on medical bills every year. So learning really how to save that money if we can is a big thing. And then also talking about preventative care. Really, how does preventative care really help us in these situations? So we're going to talk a little bit about all of those things. And first up, here we go. We're talking about the options for care. So we have MD Live, which you'll hear a little bit about from Ernesto. We have your primary care physician, which we'll hear about from Kathy. We have retail health clinics and urgent cares, which Jonathan will cover for us. We have the hospital emergency rooms, which Clarissa will cover. And then myself, I will be covering those dreaded freestanding ERs. So let's get started, and we'll go ahead and talk to Ernesto.
All right, great. So thank you everybody for attending. And I know this is useful information. Those of you who need to talk to their employees, or if your employees contact you, come to your office, whether you're HR director, treasurer, auditor, whoever is having the benefits, this is great information for you to advise your employees where to go if they come with any questions. So as you know, MD Live Telehealth, this is a service that is available 24 hours a day, 7 days a week. These are for non-emergency issues, okay? So you can use this at home or even while you're traveling, if you're on vacation, if you get sick or anything, because you can talk to MD Live via telephone, or it could be a virtual visit. So it's your option, okay? If you have a laptop or maybe an iPad, you can talk to them if you're sick and everything. So one way to, and usually the average wait for this is almost 20 minutes, but where can you access MD Live? You can go onto your Blue Cross Blue Shield website, or you can go to the employee single sign-on and go to the Blue Cross Blue Shield website right there, and there's a link to MD Live. You can also download the app on your iPad, on your phone, and you can always talk to a doctor if you have any type of issues, non-emergency issues, so that they can take care of you as well. And speaking of doctors, I don't think there's many, or there could be possibly in-network doctors who do help with that are in the MD Live, but possibly the majority of the doctors that you will see, they probably would not be in network. But more than likely, it does not matter whether they're in network or not. Whichever doctor you see, guess how much for this services will be? It's going to be $0. There's no copay. If you are a fully insured group in our health pool, it's going to cost you nothing. Okay, if you're self-insured or ASO group, you may have a copay, but for all of our fully insured group, it costs you nothing. So the benefit of this MD Live telehealth, it's going to save you time, it's going to save you money. But what another important thing or advantage to these virtual visits is the cost of the claim. We're trying to direct you where you need to go for certain care and everything. But for these non-emergency issues, the claims, as far as the cost, is much less by going to MD Live versus going to the ER or urgent care for a non-emergency issue. If you just can't get out of bed, if you have COVID or whatever the case may be, MD Live could be the best service for you. So that way, when you set up your profile for MD Live, you can actually put your pharmacy information, and whenever the visit's done, the doctor, if you need a prescription, they can send that to the pharmacy of your choice that you've put in on your profile and everything. So what kind of health issues or non-emergency issues can they help with is general health, allergies, asthma, sinus infections, and if you got kiddos who are covered, they can, for ear infections, okay, pink eye, okay, cold and flu, okay, if they're running a fever, call MD Live so that way a doctor can see what those symptoms are, and it's going to save you time and save you money. If you're out in rural Texas and it takes you a long time, or it could take maybe 50 sometimes in parts of Texas, you may have to drive 100 miles to get to see a doctor sometimes. But MD Live, you can set up anytime, 24 hours a day, 7 days a week, for those type of emergency issues. Yes, sir.
Yeah, I just want to add, so if you're on any kind of maintenance medications, you referenced asthma.
Yes.
I'm asthmatic, and as much as my parents tried to get it out of me when I was a kiddo, I still leave my inhaler a lot of places. So it's a great option. We're in a pinch. If you need to get an inhaler, call in. I've done it a couple of times.
Absolutely. Yeah. It's convenient. Like I said, it's very efficient. It's going to save you time and save you money. And in addition, there's behavioral health issues that if you're suffering from anxiety, depression, even child behavior learning issues, relationship problems. Now, this is not just for marriage counseling, but if you have any problems with your marriage, you can actually talk to somebody about their marriage. So just keep in mind, there's a big difference between marriage counseling and just talk to somebody about marriage problems. But there's all kinds of things that you can do with MD Live, and I totally highly recommend doing this versus going to your emergency room, going to urgent care, because sometimes you can't get access to them sometimes. Even if your primary care physician, if it's on a weekend, you can't get in to see them, virtual visit with MD Live is going to cost you $0 out of pocket. All right? All right, with that, I'm going to go ahead. Did I miss out anything, guys? I think that's pretty much it.
I think it's awesome, since I have kids, putting them in front of the TV on the couch instead of loading them into the car and taking them somewhere. Mm-hmm. A lot of times it's way easier. And, as soon as the doctor's on, you pause the cartoons and you just put the phone in front of them, and it's so much easier than,
It seems like kiddos are more likely will want to talk to somebody on a screen than in person sometimes, because it's like.
And I'm sure yours know how to work their phone better than you too.
Yeah, especially my grandkids. Absolutely.
Well, and something also to add is that the cost of claims for MD Live is significantly lower than a primary care physician. So having MD Live available 24/7, being so convenient, is also a cost savings to your group health insurance plan as well.
Absolutely, because I think the average cost on an MD Live is like $55 versus you go to an emergency room. I guarantee you, on average, that emergency room visit, that claim is going to cost at least $3,000 or more, depending on what you need. So there, not only you're saving yourself money, you're saving the county plan money as well by deciding where to go for certain non-emergency issues where you're saving money on the county end, but on your end as well. Yeah. I think next we're going to turn it over to Kathy, Kathy, take it away.
Okay, and I'm going to be talking about your primary care physician. My primary care physician actually participates with MD Live, and that has come in really handy whenever I've been out on the road, and he kind of knows my overall general health. But the point of having a primary care physician is to help facilitate that doctor-to-patient relationship. And that relationship is very important, especially if you've got things like chronic conditions. They can help you if you need to be sent to a specialist for a reason. They can help get you into that specialist. Plus, they can help you make sure you stay in network. And we all try and stress how important it is to stay in network, but they also, with that communication, they can do medicine reconciliations that a lot of people don't think about whenever you are seeing several different specialists for different things. They're throwing just pills at you. Nobody really asks what type of medications you are on. And a lot of times, some of those medications will fight against each other, and they can help bring about that reconciliation to maybe help you get away from some of those issues. The other thing that your primary care physician can help with is early detection. And guys, you always hear us talk about getting your annual physicals done. And the reason why is to avoid those catastrophic illnesses that take up a lot of your own money, but they drive claims for our groups. So your primary care physician will handle a lot of your preventive care that you need done, that chronic disease management, the referrals, your annual physicals, and one of the big questions I get from my groups is regarding the annual physicals. There are a ton of different annual physicals that you can have done, and you're not, as members of the pool, you're not limited to just one annual physical per year. Eye exams, that's an annual physical. And a lot of diseases, especially regarding heart disease, can be found through a routine annual eye exam. And that's why we know we drive you crazy with this information, but that's why it is so important. Next, we're going to talk about the different screenings and preventive care for adults and children, vaccines. Folks, all of this information is in those resource guides that we send every year. But if you ever have any questions, reach out to us. We're more than welcome to help. And the thing is if your group has a non-grandfathered plan, all of these screenings and preventive measures, they're available at no cost. The plan will come in and pick up
No copay?
these screenings, for $0 copay. The biggest thing what we find whenever it comes to these is maybe coding issues where doctors don't, and vice versa for those groups of you that are still grandfathered. What we're finding is they'll go into the doctor's office and there's like, oh, it's an annual physical, you're fine, you don't owe anything, and you're sitting there going, I know my plan. I know it's grandfathered. I know I owe this copay. So just keep up the good fight, guys.
It's covered until you get that bill in the mail.
It's covered until you get that bill in the mail, precisely. So like I said, all of these measures are covered at 100% by the plan with maybe a minimum copay. So it's very important that you go and get these screenings done, stay on top of your health. And going through and with the children, if you notice some of those, it's a lot of the same screenings that adults will have. The reason for that is we are starting to see an increase in claims for anxiety and depression for our children. So it's really important that you stay on top of that. And whenever we talk about the vision screenings, We recently ran into an issue, well, not recently, it's been within the last year, but my grandson was having horrible headaches. And children, they're not very explicit in what's going on, but that's what was causing his headaches, is he was straining to see what was on the board or the screens that they use at school. So it's not only important for you as the adult or the parent to stay on top of your screenings, but stay on top of them with your children also, regardless of whether or not you have them on the plan. Take them to the doctor, get their screenings, please.
Absolutely.
Okay.
Excuse me. So now we're going to talk about urgent care. I am a pretty frequent urgent care customer. True story. There was one time I was slicing sweet potatoes and I took a chunk of my thumb off and had to go get stitches, and urgent care helped out. It was pretty great. I'm a big fan of that. The great thing about urgent care is that it does operate at a copay level. So it is going to be a little bit more of a copay than your primary care copay or your specialist copay. But it's great for those times when it's just not convenient. Weekends, nights, things like that. I tell people in all of my open enrollment, so if any of my folks are on here, they've heard this before, but the side of my refrigerator, I've got a list of the urgent cares of which ones are open, what days they're open, what their hours are. Because I've got a 13-year-old kid, and he's pretty active and doesn't always make smart, decisions with his own physical safety.
Is that him or is that you?
A
little bit of both.
A little bit of both. I mean, he's my kid, so yeah, it makes sense. No, I mean, it's just there's really great options. Obviously, the kind of things we always say is that if you have, chest pains or stroke symptoms, things like that, obviously you're going to want to go to an emergency room, and we'll get more into that. But when it's more serious that you don't want to wait for your primary care to open the next day, that's when urgent care options are really good and really helpful. So some of the reasons you might need to go to the urgent care: high fever, flu, sore throat, cough, sprains, strains, stomach stuff, cuts, accidents, things like that. It's all pretty easy to handle at urgent care. I know some of them even have abilities to set bones and casting and things like that. So it's just important to kind of maybe look around to see what options you have. And I know not all areas have a lot of urgent cares available to them, and especially out some of the West Texas areas. But just pull it up on the provider finder and see which urgent cares are near you, and then you can get an idea of where to go from there. So now we're going to talk about the hospital emergency room.
Hospital emergency rooms. So these are different from your freestanding emergency rooms that you see maybe on the side of a corner in a shopping mall, because they do not charge facility fees. And Orlando is actually going to talk about freestanding emergency rooms after this, to kind of give you a clear distinction between a hospital emergency room and a freestanding emergency room. Of course, with hospital ERs, they are open 24/7, so that's all hours of the day, 7 days a week. One unique thing about hospital emergency rooms is that there are multiple bills for services such as the doctors and facility fees. So you could have some providers that are a part of the hospital in the network. But sometimes on the off chance there are, maybe those anesthesiologists that aren't in the network or contracted with Blue Cross. So we typically get this question out there from employees quite often. I know in the South Territory I get this. But anesthesiologists, getting bills from anesthesiologists when a member goes to the hospital. So with anesthesiologists, a lot of them do not contract with Blue Cross and Blue Shield of Texas, and so the providers that are working at the hospital do have the option to contract with Blue Cross and Blue Shield of Texas. So it's important to know if you do have maybe an inpatient surgery that you're planning, to just make sure that all the providers that are seeing you or that you're getting services from are contracted with Blue Cross. Of course, in those emergency situations when you're not able to make sure that all providers are in the network, as long as it's a true emergent situation, Blue Cross is going to pay the allowable amount for that service. So something to keep in mind, there are multiple bills for services such as the doctors and the facilities with these hospital emergency rooms. This, of course, is going to be an option for life-threatening or disabling conditions. It's not going to be an option for stomach ache on the weekend or something minor where you could be calling into MD Live.
What if I have a real bad headache?
No. I mean, if there's a seizure, and we'll actually talk about some examples here, then these examples here are reasons to go to the emergency room. Of course, chest pain or difficulty breathing, seizures, even broken bones or dislocated joints. I know we talked about some urgent cares are able to do services for broken bones or dislocated joints that are not as severe. With those severe broken bones and dislocated joints, we do recommend going to the emergency room. Slurred speech, concussions, maybe your child plays sports, fevers with rash, or even serious burns. All of these are examples on reasons on why you should be going to the emergency room. So it gives a good idea of, when to go to the ER. And one thing to keep in mind, as Jonathan had mentioned earlier, he keeps a list of those urgent cares that are in network on his fridge. I would recommend doing the same with emergency rooms. Even if it is a minor emergency, it's still an emergent situation. You are able to kind of direct yourself to that emergency room that is in the network. So these do get updated on a quarterly basis, I believe, on the Blue Cross website. So you want to make sure that you're staying up to date with those in-network providers. And now I'm going to turn it over to the scary freestanding emergency rooms that Orlando's going to talk about.
And the boogeyman enters the chat, right? This is the one that we don't want to talk about, the one that we see the big claims on. So freestanding ERs. These are ones that are not, they're typically not in network. They're open 24 hours a day, 7 days a week. They have all the perks, right? They got warm cookies in the.
It says emergency room.
Yeah.
I mean, yeah.
They got warm cookies. They can give you massages in the weight rooms. I think they can take your car to get it detailed.
Probably.
They offer all these different things that are really cool.
waiting time
No waiting time.
Yeah.
No waiting time.
A lot of them, when they first pop up, they'll say, "Oh, we'll waive your copays. We'll waive this stuff," and it's great, right? Until you get that bill later, and it's a lot more than what you expected. And the main reason is because they're not in network, right? So, I'm sure all of us have spent so much time looking at benefit highlights, right? And we have those in-network column and then that out-of-network column. And so these freestanding ERs are going to fall in that out-of-network column. So when your employee goes in, well, they're going to be paying a lot more out of their own pocket to go to these places. And then on top of that, the plan is going to be paying more, and then they're going to get that balance bill at the end as well.
Well, and they're tricky too because they'll say they take Blue Cross, but taking insurance and being in network aren't always the same thing.
They'll take everything. They'll take no insurance. They'll take anything. They just want you in the door, honestly. But they a lot of times they don't offer the actual true emergency room services. So then you go there, you pay the facility fee. But then they're going to end up transferring you to an emergency room that's attached to a hospital also.
Hospital setting, yeah.
And so, there's a lot of different reasons why this is not a great option. But we're also, we're talking about why not to go there. How do you know what is a freestanding versus what is a hospital ER? And so a lot of times these are the ones that are found in the strip malls and they're in your, your neighborhoods. They are the ones that usually have emergency room in the title.
Are they attached to a hospital? That's a real good indicator.
It's like
I've seen them by themselves in one building too.
Right.
yeah.
And there's also those freestanding ERs that are connected to an urgent care center.
Yep.
The urgent care might be in network, but the freestanding emergency room will be out of network. So you always want to make sure you know where you're going and make sure that you know if they're in network.
And then the other tricky part, and we know that there's a lot, but some of them act as a in-network urgent care from 8 to 5 Monday through Friday, but then as soon as it's off hours, then they're a freestanding ER. Ooh. So they have it's all about knowing, you don't know what you don't know, but that's what we're here for, is to help you guys understand kind of how to navigate through these, because the biggest thing we don't want is we don't want employees spending more money than they have to.
Yes.
And we don't want the plan spending more money than it has to.
Well, and as your consultants, I know we get this question a lot. We'll have something pop up in a neighborhood, and our groups will ask us. So if you're not sure, if it's a little tricky to figure out, give us a call, because we're happy to do that research for you.
Absolutely. And so you do see that they'll have the ambulance bay usually. And so as much as you might like it, as much as it's probably a nicer facility, because a lot of these are private-owned corporations, and they will make it as nice as possible. They will have the newest equipment and everything, but we're going to end up paying for it, right? And so we'll talk a little bit. You'll see a video that kind of goes into a little bit more detail about kind of some of these things, but the main thing is just we want to make sure that. Also, I think the last thing is if it is a true emergency. I mean, if you are, as Ernesto said, out in West Texas, and you have a freestanding ER that's 20 minutes from you, but you have a hospital emergency room that is an hour away. Well, go to the freestanding, because if it's a true emergency, if your head's split wide open, if your arm is detached from your body, go wherever you can go.
You have no
right?
choice.
You have no
You
choice.
have no- yeah.
Yeah, and the thing is, whenever it is an actual emergency, the employee will have to pay only the in-network benefits, and Blue Cross will pay at the allowed amount. So this is more so for those. Hey, I got a tummy ache. I'm going to go to the emergency room. Well, one, you shouldn't go to the emergency room, and then two, you definitely shouldn't go to the freestanding emergency room.
Well, Orlando, I don't know about you, but I would like to know where these freestanding ERs in West Texas, because we don't see them too many in West Texas. I wish we can get some of that information.
Yeah, absolutely.
And provide it to our
We do have a
audience.
map. We do have a map.
Oh,
So
okay,
we'll show you at the end kind of a map of kind of where they are.
All right.
But the big thing is, why is this important? Why are we bringing this to you guys? And I think it all comes down to being smart, being educated about what's available to you, to your employees. I know talk a lot about rates and renewal, increases and that kind of stuff. And these things really do factor into that, because a claim that could cost $55 to the pool, you go to the wrong place, now that $55 claim turned into a $3,000 claim. And when you have hundreds of employees, those numbers really start to add up.
They will add up.
And that takes you from maybe a 2% increase to an 8% increase, just little by little. So we really want to make sure we're educating our coordinators, our employees, everyone who's on the plan of all of the options that are available to them and when those options are appropriate, so that way they can be smart users of their benefits, and then we can kind of help everyone. Everyone wins when we all kind of have more data and more information to go off of. And so you'll see here, this is a where to go for care. In your resource guide, as Kathy mentioned, there's a lot of this information just kind of about MD Live and the different programs. But this kind of outlines the cost. Obviously, Ernesto mentioned MD Live is free. You don't pay for it. It's not a copay. Your doctor's office, you go from there. Your freestanding is going to be that most expensive one. But in your resource guide, there is a flyer that talks about this in more detail. But this is the main reason why we're talking about this, is because as you change your care, the costs go up. And so now what we're going to do is we're going to play a little video for you that talks a little bit about kind of what you see in these freestanding ERs, and kind of the differences between the hospitals and the urgent cares as well.
Freestanding emergency rooms. More than 200 of them have popped up in retail locations across Texas. And lots of people confuse them with urgent care, but it's not the same. Urgent care is like going to see your family doctor, and they bill you at family doctor prices. Freestanding ERs are like going to the hospital, and they bill you at much higher hospital prices. So is this trend of freestanding ERs, is it good for Texas?
My name is Jeff Rutledge. I'm here because I got a balanced or surprised bill from an ER when I went in.
The freestanding ER told Jeff they accepted his insurance, even though his insurance company was not in network. He ended up with a $12,000 bill, and the insurance company paid $215.
What these companies are doing is they're basically just going after the people that need help the most vulnerable people The poor people, the people that are out of network, are the ones that are getting stuck with these giant, outrageous bills that they never agreed to.
This year, Texas lawmakers passed 4 laws to rein in freestanding ERs. One of them limits surprise bills, like the one Jeff got. Another stops the practice of misleading patients about insurance coverage. But even with the changes, depending on your insurance coverage and out-of-network costs, some patients will still pay more than they expected. I went to the offices of Blue Cross Blue Shield of Texas. Dr. Paul Hain is the chief medical officer.
The concept of the freestanding ER, do you think it's good for Texas?
So far, the way it's been rolled out, it has not been good for Texas. What we've seen is a massive increase in the price of care and people being fooled into paying way too much.
He's talking about this study in the Annals of Emergency Medicine. It found the most common problems they treat are things like upper respiratory infections, sprains and strains, and stomach aches. Things that cost less to treat at urgent care. That's because the price per visit at a freestanding ER in Texas is $2,199, and urgent care is only $168. This study has been criticized because the raw data was provided by Blue Cross, which opposes freestanding ERs.
So it's the same care, but in a freestanding emergency room, it's at 10 times the cost.
Why does it cost 10 times more?
Well, it costs that much because they've decided to charge that much.
Blue Cross is out of network with all freestanding ERs. They believe they're overpriced and drive up the costs for everyone. But that means its customers can be exposed to enormous bills.
There's this thing called a facility fee that an ER is allowed to charge, which just means when you walk in, we get to charge you several $1,000s for walking in as part of maintaining our overhead, which urgent cares don't do. So just by crossing the threshold, it can be $3,000 before anything happens to
And
you.
people don't know walking in the door costs them $3,000.
Not at all. Not at all.
I got a list of all the freestanding ERs in North Texas, then plotted them on a map and overlaid census data for income level. The darker green areas are the more affluent zip codes, and that's where most of these ERs are located. For example, in Frisco, there are 5 of them, promoting shorter wait times and comfortable spaces.
A little bit more quiet environment, a little bit more time with the patient.
Dr. Paul Kivala is Chief Strategic Officer with a chain called Code 3 Emergency Room.
The great thing that freestands have done is they've upped the ante for the hospitals. Before, when they were the only game in town, how long did you wait at the emergency department? A lot of times the wait times, even in downtown and suburban Houston, were 8 hours, 10 hours, because they were the only game in town. And so I think, what we've done here is we've upped and improved the quality of care.
Through competition?
Through competition.
Code 3 is 2 miles away from a Baylor Scott and White hospital where, according to a project called ER Weight Watcher, patients are seen by a doctor in about 12 minutes. And that may not be because of the added competition of freestanding ERs. This study in the American Journal of Emergency Medicine found freestanding emergency departments in Texas do not alleviate congestion in hospital-based emergency departments. But what makes Code 3 different from some others in the industry is that it also has a less expensive urgent care clinic under the same roof, so patients can decide for themselves where they want to be treated.
We think we developed something that is patient-centric, and we designed this from the patient's perspective rather than from anybody else's perspective.
Should all these freestanding ERs have both?
We believe it's the best model is the hybrid.
I learned that freestanding ERs give Texans more access to emergency care, shorter wait times, comfortable surroundings, and some of them even offer urgent care. But on the other hand, the legislature had to step in to regulate them. The most common problems can be treated for less money, and competition has not improved hospital wait times. So are freestanding ERs good for Texas? They could be one day, but right now they create more problems than they solve. If you've got something you want verified, send me an email.
All right, and so as you can see, they're talking about those differences there that you'll see there. And so what we're going to do now is we're going to talk a little bit more. You click me in, there you go. So there's over 200 freestanding emergency rooms in the state of Texas.
What about West Texas?
Okay, you want to get there. All right. So here's the map. Here's the map. Be patient, Ernesto.
There you go. Awesome.
So, as you can see here, the concentration of those freestanding ERs is going to be in those, major metropolitan areas, Austin, Dallas, Houston. And so out west, you have a couple sprinkled in there.
Yeah, Tom Green, must be San Angelo there.
So, we're going to focus our efforts there. We're going to make sure that, they know that there. But, out in those areas, those might be the closest ones. Even though they might be, as you said, 100 miles away, that might be the closest one. And so just knowing where they're at, knowing how to tell, whether it is a freestanding or not. Blue Cross Blue Shield is going to be, the Blue Cross Blue Shield app is a huge resource for you to do a provider finder. So there's a lot of different ways that we can know whether they're in network or not. So let's just be cognizant of it, make sure that we know where those are at, and that we're not going to those if we don't have to.
In Orlando, you're also able to find the map like this, an updated one, as time progresses, as these new freestanding emergency rooms come up. On the Texas Department of Health and Human Services website. So this information is available on there as well. But of course, as Orlando mentioned, the Blue Cross app is going to be super helpful for finding those in-network providers.
All right. And so then we are happy to answer any questions that y'all have.
Please enter them in the chat box, and we're going to hang on for a few minutes in case there's any additional questions.
Yeah.
Please, if you want to ask what our favorite color is or whatever the case may be, please ask.
And one thing I do want to mention is that, so I did this recently in Fayette County. I actually presented this presentation to employees. So if this is something that you found useful and that you would like for us to come out and talk to your employees about, we'd be happy to do it. We can do it as a Kahoot, or I actually took Monopoly money. And so we gave them money, and then I gave them prices. And so whatever they decided to go on with certain scenarios is how much money they have left over. So this is definitely something we can bring to your county, and it's definitely something that I think they found helpful to actually take to the members. So.
And we've talked a lot about having us out for open enrollment events. If you have us out, we're happy to speak to this. I know I always do when I've got the opportunity.
Absolutely. There's so much that we can cover at open enrollment. That's what those resource guides are for and everything, But, if you didn't make a plan change, this is a great presentation that can take up a lot of the time for those presentations in open enrollment, because nobody's there to really tell the employees where to go, what the decision make, because ultimately we want to keep those high cost claimants down. And as you can see, the ER visits, the freestanding ER visits, if we keep seeing those claims come in and over, they do add up. Because ultimately at the end, depending how you use your benefits, okay, and how you choose to use your benefits and where to go and everything, can somehow have a negative impact on your rates going up. Okay, so but please invite us out here if there's something you want us to do. It doesn't even have to be open enrollment. It could be sometime mid-year or whatever the case may be.
Anytime in the year.
We're available for
Absolutely.
chili cook-offs, baptisms,
Thanksgiving, lunches.
Absolutely.
All
I guess
right, I don't
that's
think we
it
have
for
any
today.
questions. Yeah, so.
Thank you all for taking time for us, and we'll see you out there on the road.
Get back to work.